Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're back on one of our Monday live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is your chance to ask questions to me, so please feel free to put your questions into the chat. It's also my chance to not only interact with you live, but also to answer any of the questions you may have submitted onto the videos. Remember, we're also on Facebook and Instagram for additional content. Those will be linked. And please like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator. So I'm going to go ahead and I'm going to get started right away with some of the questions that you guys have submitted over onto the other, onto like the videos themselves. So we got a question, we got several questions this week on drying up milk supply. So drying up your breast milk is an extremely important topic because not everybody breastfeeds. Some people need to stop as soon as they can when they're done breastfeeding. Unfortunately, for our moms who have a miscarriage, they also need assistance with drying up their breast milk. So this is one of those things that we need to make sure that we address right away. So the first question was, I'm a single lady and I've never given birth before. Before my monthly periods and after my monthly period, my breasts produce milk. What should I do? So this is the starting point for this week's questions. So a lot of people don't realize, but you can actually make breast milk even if you've never given birth. In fact, men can also make breast milk. And that's because breast milk is produced by a hormone called prolactin. Prolactin is actually the milk-making hormone, and it's also the hormone we try to stimulate when you are breastfeeding to increase your milk supply. So you can have prolactin increase by a variety of different ways. For starters, there's several medications that can increase your prolactin, including something called a category of medications called the antipsychotics. Antipsychotic medication is often used, amongst other things, for schizophrenia and bipolar. These medications have a potential side effect of increasing prolactin. Prolactin can also become increased due to stress, and it can become increased due to a prolactinoma, which is actually a tumor on the pituitary gland. So in order to determine what's going on, you actually need to go to an endocrinologist who can test your blood levels. And they can also order that MRI to determine if you actually might have a prolactinoma. So you want to go ahead and you want to get that checked out. You can talk to your primary care provider about referring you. Now, the next question I had is, well, I had a comment on the video and it says, I have a baby who is 2 years old now and I am currently 8 months pregnant. My son still latches onto the breast and I want him to stop because I feel irritated due to tender nipples. He wants me to sleep. I'm sorry, he just uses it when he wants to sleep. Sometimes I do not mind, but it irritates me all the time. I just cry all the time. So this is a mom who desperately needs to kind of decrease her milk supply in order to help wean her child. Unfortunately, you can't take most of the natural remedies that we use to dry up milk supply when you're pregnant. So instead, what I would encourage you to do is 2-year-olds tend to understand a lot of things, including that you might have boo-boos on your boobies and you put some Band-Aids on there to tell your child that you can't breastfeed anymore. You also want to make sure you draw a hard line. You're going to have a couple nights of some crying, and then your child will get used to not breastfeeding because as soon as the baby's born, the baby's going to need to breastfeed instead. So it can be very hard, but it is probably time for you to wean. But you can't use any of the traditional medications that we would use to dry up milk. So the next question was, I just want to know if birth control tablets can work to stop breast milk supply as well. So I think this is a great segue into some of the medications that can help to dry up milk. So yes, certain birth control pills we actually want you to avoid if you plan on breastfeeding because they can help to dry up your milk. Specifically, estrogen-containing birth control pills are more notorious for potentially drying up your milk supply. Other things that we use to dry up milk supply can include some of the allergy medications like Benadryl and Sudafed. You can also use peppermint. There are definitely some herbs that you can use. And so it's really important for you to kind of look those up. But we have a video on it. We linked it into the description. However, yes, if you take an estrogen-based birth control pill, that might assist. So next we had a question about about a menstrual period. So the question is, on May 11th, I met with my partner for dry sex. I need some advice about my menstrual cycle. Last month, my period was on May 23rd, and it only lasted for 3 days with a very light flow, which is unusual for me. During that time, I experienced black discharge and dark blood on the first day, something I've never seen before. In June, my period restarted on the 14th and lasted for the usual 7 days with bright red blood. Now in July, my period is due to start on the 8th or the 14th, but on the 8th, I noticed dark blood in the morning with no bleeding throughout the day, and brown discharge on the 9th with white discharge. And today on the 10th, I've seen brown discharge. I'm worried that I might be pregnant, although I had my periods in the last 2 months. Can you please clarify what these signs might be? So you can bleed during the first trimester of pregnancy for a lot of different reasons. You can bleed due to rough sex. You can bleed because you have like a sexually transmitted disease. You can bleed because you're actually bleeding from the rectum. There's so many different reasons why you can bleed. And so if you are pregnant, that could be why the bleeding looks different. Another thing it can cause you to bleed is a subchorionic hemorrhage, which we're going to talk about. But if you suspect you're pregnant, the first thing you need to do is take a pregnancy test. Your period could be off because you have a sexually transmitted disease without a pregnancy. Your period could be off because your hormonal levels are off. Could be, for example, because of a pituitary gland tumor, like we talked about with the previous person who I recommended get an MRI. If your thyroid is off, that can cause menstrual issues. If you have PCOS, that can also cause menstrual issues. So there's a lot of different reasons why your period could be abnormal. So what you want to do is you want to go and get that checked out by starting with a pregnancy test. Taking a pregnancy test will help determine what's going on. However, a lot of those different description of blood could be normal. Brown blood is usually old blood. It's a sign of previous bleeding. Dark blood is oftentimes the sign of old bleeding as well. It's the point between dark red and brown, and it just comes out as like a black. So all these different colors of bleeding sound like they could be normal depending on what's going on. If you suspect pregnancy, though, the first thing you need to do is have a pregnancy test done. So going into that, one of the most common causes of bleeding can be a subchorionic hemorrhage. So a subchorionic hemorrhage is kind of like a bruise. So you have your placenta, and the placenta is the organ that feeds the baby. And that placenta, the one side is covered with blood vessels, and it attaches to the uterine wall, which is covered with blood vessels, right? So that ends up being this like bed where blood goes back and forth. Now, if you've ever had a bruise on any part of your body, basically what that is that you hit that area and a whole bunch of the blood vessels break, and it causes a pooling of blood underneath the skin, which you see as that black and blue area, right? That's a bruise. That breakage of blood vessels, well, that's a subchorionic hemorrhage underneath the placenta. So basically a section of the placenta, the blood vessels have broken and it pools blood. And as a result, that pooled blood ends up showing up. And sometimes it will leak out and then you have some spotting. So that's what a subchorionic hemorrhage is. So subchorionic hemorrhages can be very normal. In fact, a lot of times we only see them by chance. So a mom won't be bleeding, there won't be any symptoms, but we do an ultrasound and we find it there, right? So that's where we can see these subchorionic hemorrhages. So really it can be normal. So going alongside of this, we had a question that said, I have a large subchorionic collection, almost 90%. I'm 5 weeks, 4 days pregnant. Is there any hope? Okay. The one of the other questions I actually want to answer at the same time. It said, I was found to have a subchorionic hemorrhage of 6 millimeters by 2 millimeters on the inferior aspect during my 7-week scan. My 9-week scan still shows the same. Is this a normal size or any complications? No bleeding for me. So the second question actually kind of highlights what I just said, which is that a subchorionic hemorrhage is sometimes just found. There is no actual symptoms. In the second question, she gives some sizes for her particular subchorionic hemorrhage, while the other one gives a percentage. So what are we talking about? So percentage, you've got your placenta. This is the whole placenta here, okay? 90% is exactly what that sounds like. It's 90% of this area. So it's most of this area is this bruise. Now, just because you have a bruise, remember guys, if you have a bruise on your arm, you're still getting blood flow to that part of your arm. You just have broken blood vessels there as well. So it's not like your arm dies. Now, a subchorionic hemorrhage of that size is worrisome, but it is not necessarily catastrophic because you have to give the placenta a chance to figure out what it's going to do. Now, when your baby starts out in your uterus, it is teeny, 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 tiny, like small, small, small. And the placenta is even smaller, right? So your placenta starts out small and it gets bigger and bigger and bigger and bigger as the baby gets bigger and bigger and bigger. So by the time you deliver, your placenta is kind of like about that big. It's kind of about that big, okay? So you have this placenta. Now, when you start out with your subchorionic hemorrhage, right? Imagine if this is your placenta size and this is the subchorionic hemorrhage, right? That's a pretty big piece of that. But as your placenta grows, if the subchorionic hemorrhage stays the same size, it's actually resolving. So it's actually getting better. And this is oftentimes what happens. The placenta grows, but the subchorionic hemorrhage stays the same size, and eventually it actually shrinks back and then it goes away. So that's why when the 7-week to 9-week ultrasound is still showing the same size, that's actually a good thing. It's really good that the subchorionic hemorrhage is not getting bigger. Now, for the person who had 90% of the placenta as a subchorionic hemorrhage, yes, that's concerning. I hope they're monitoring you. I'm hoping you're getting more ultrasounds because they should be following that. But it could resolve and it could get better over time. So it's just one of those things. Now, another question I got about this was I went to the doctor at 8 weeks and 4 days, and they saw some slight bleeding on my scan. They prescribed tranexamic acid for 10 days. Everything else was fine. Should I take the medicine? Is this the right treatment? So tranexamic acid is actually a medication that's used for blood loss. It actually reduces blood loss, and it is used commonly for subchorionic hemorrhages. I don't know why necessarily they would give it to you if there was not a lot of bleeding. It is not commonly given, but it is safe for pregnancy, and it can be used to reduce blood loss. So what I would tell you is this is something that you should be considering. But I would absolutely ask for a risk-benefit analysis because if you're not bleeding a lot and they tell you can only do it once and then you can't do it again for a little while, then you may not want to take that at this time. You also want to make sure that they're giving you active scans to see if the subchorionic hemorrhage is resolving because you want to know if the treatment is working. So now let's talk about some second trimester bleeding. So I am in my second trimester and 4 months pregnant. I had a little drop of blood in my underwear for 2 days. What does the report say? And then it says, it's my 18th week of pregnancy. Today I had spotting. Is it normal or is it something that I need to panic about? So again, first of all, the hormones that are needed for a healthy pregnancy thin out the vaginal tissue. So because they thin out the vaginal tissue can actually like tear during rough sex or if you're not lubricated enough. If you also wipe yourself too hard. You can also get bleeding or spotting if you have any number of infections, including sexually transmitted diseases and urinary tract infections, and also actually yeast infections. So these are reasons why you might see spotting. The second you see spotting, you need to contact your healthcare provider because especially when you get into the second trimester, we're able to do a lot more depending on how far along you are. We're able to potentially give you medications that can help to mature the baby's lungs. We're able to administer different types of medications to treat infections. Infection can lead to miscarriage, stillbirth, and preterm birth. So you want to make sure you're getting these things addressed right away, because if it's a urinary tract infection, it can be so simple for us to treat. So it is very important. So do you need to panic? No. Are you potentially going to just be monitored? Yes, but you need to contact your healthcare provider so they can do, amongst other things, an ultrasound to see if they see the reason why you're bleeding. If you are, so like if you have some spotting and you're not really sure what to report, I guess is the way to put it, feel free to take a picture. I know that might seem a little gross to some of you guys, but believe it or not, we've seen a lot. And taking a picture on your phone of spotting so that you can show it to somebody and be like, I think this is bright red bleeding. And they're like, no, 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 this is brown. Or I think this is just a drop of blood and it's like the size of a quarter. And we're like, oh, no, 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 that's not just a drop. That's like a quarter size. Those are really important conversations to have with your healthcare provider, because it gives them assessment information to determine what cause they might be looking for. And it gives you the ability to learn what you're actually looking like and how to describe it if it happens again. So feel free to take a picture, guys. It's not unheard of. So when we're talking about all of this, like I said, there's a couple different types of infections that can lead to this. So one of the infections is urinary tract infections. So one of the viewers sent in a question that said, I'm 6 weeks pregnant and today I saw some dirty things coming out with the urine. Could you help? Is it okay during pregnancy? So the answer is no. If you guys have any kind of discharge that looks off, you want to make sure that you're going ahead and you're getting that looked at. Dirty urine is very likely to be a urinary tract infection, but urinary tract infections are a lot more serious than people realize. Okay, I see your question, Sandra. I wanted to stop to see if it was related to urinary tract infections, but I will answer that in a second. So urinary tract infections are extremely serious. If left untreated, what ends up happening is you can actually get the infection to spread up into the kidneys, and then the kidneys will actually potentially turn into sepsis, which is a blood infection. So you want to make sure you're getting treated. If you see dirty urine, you want to make sure it's tested. Your OBGYN can do that. The hospital can do it. It's a quick little test. We just dip a stick, we send it in, we're looking for a couple different things. And if there is an infection there, we're going to give you antibiotics. So antibiotics are the key to a urinary tract infection. One of the things that I also had was a mother who's trying to conceive, and she said she was 3 days past ovulation. She started having some pain when she urinated, frequent urination, discharge, feeling feverish, metallic taste, decreased hunger. Please prescribe a medication is what she says. What you need is to be tested for a urinary tract infection, and you probably need an antibiotic. But if you notice, she said that she was feeling feverish and she had other systemic symptoms, system-wide symptoms. That means she was probably developing sepsis. So you have a urethra. It's a small tube. It sits above the vagina, but below your clitoris. This small tube, the urethra, goes up into your bladder. Okay, it's like a little straw. The reason why women get so many urinary tract infections is because the bacteria travels up, and then it sits inside the bladder, which is warm, dark, moist, and it sits in there and it grows. And then outside of the bladder, there's 2 ureters. And these 2 ureters, again, are small tubes that lead up to the kidneys. So when that bacteria gets up into the kidney is an organ that filters your blood. It filters your blood and it produces urine. And so there's tons of blood flow in here. So when the kidney gets infected, it goes straight into your bloodstream, and you'll start to get stuff like pain, fever, weird symptoms. So that was probably the sign of pyelonephritis, which is a kidney infection that leads to sepsis. So you need to get checked out by your doctor. You probably need an antibiotic. All right, Sandra, is it normal to not have any symptoms besides peeing a lot and bloating at 9 weeks pregnant with twins? absolutely, you could be one of those lucky, rare people who don't have symptoms. In fact, it is very disconcerting for a lot of women because they will compare their pregnancy to other people's pregnancies. They will compare their pregnancy to their own pregnancies that they've had in the past. And when it's very different, they're not sure. Peeing a lot is a good sign. Bloating makes sense because you actually are probably going to show much faster. But sometimes you just don't have any other symptoms. Morning sickness does not happen for everybody, and it is not necessarily consistent throughout. Um, what you want to make sure is that you're following all the things that they're asking you to do. If you have any spotting or any signs of infection, that you're getting it checked out, you're going to your prenatal visits, and they should be sending you to a maternal fetal medicine physician. Those are the high-risk pregnancy doctors to get things checked out as well. But you don't necessarily have to have a lot of symptoms, even though you're pregnant with twins. So I hope that helps. And I hope that stays this way for you. Like Sheila, okay, when you have a chance, I have a question about my hemoglobin level now I'm in the 28th week. My hemoglobin is 10.31. Ew. Red blood cells are 3.31. I'm only taking a prenatal vitamin with 27 milligrams of iron in there. However, I am taking metformin. Does it consider as a low iron level? Well, metformin has nothing really to do with iron. And neither of those levels that you just gave me, hemoglobin, hematocrit, and red blood cells, are not anything to do with your iron. They do affect anemia. You are definitely anemic. And your back end iron storage, which is actually iron and ferritin, I'm guessing is also low. So here's the deal. You probably actually need more iron than that, but you have to talk to your healthcare provider because you want them to direct that for a couple of different reasons. One, iron is very constipating. So you don't want to get constipated and then end up with a different problem. So you want to make sure that they're aware and they direct how you're going to get supplemented. Two, you want to ask them to check your ferritin and your iron. Okay, these are blood tests that can be done. I check them all the time in my practice. If they are low, you actually might need an iron transfusion. And it is very common for us to do iron transfusions for moms before they go for labor and delivery, because it's a good way to prevent them from being anemic with the blood loss that's normal for delivery. So you actually want to ask them to check that because you may need an iron transfusion, which is a lot faster. Now, as far as iron goes, for those of you guys who don't realize, many of the vitamins you need actually work better when they're synergistically, that means at the same time, paired with another vitamin. Iron is one of those things. So iron is best absorbed when you have vitamin C at the same time. So your prenatal vitamin is probably perfect in that respect because it probably has vitamin C in there. Now you may need more iron. So if you are recommended to take additional iron, you want to take that with vitamin C. But our bodies as human beings were meant to absorb our nutrients through food. That's how we were actually meant to get our nutrients. So what you want to do, and what I tell my patients to do, is go online. We've got Google for this. This is one of those times I give you permission to use Professor Google and Google foods that are high in iron. And take that list, and there are things that are high in iron that are vegetarian. So if you're vegetarian, you'll find them, as well as for our meat eaters. But look and see what are the foods that are high in iron that I eat. What do I currently eat in my diet? So for example, for you guys, I eat steak, and another one that I eat occasionally is spinach. Those two things are high in iron. Now, then you search what are foods that are high in vitamin C. Now, we commonly think about citrus food, but there's a lot of other ones, right? So now I can say to myself, I eat oranges or strawberries. So if I take my spinach and I eat my spinach salad with strawberries, I've now paired iron with vitamin C, and I've made it easier for me to absorb all that nutrients that are good for me. So really, it's very important for you guys to also look at your foods, because as human beings, we're actually meant to get our nutrients that way. So, but definitely I would have them check your ferritin and your iron level. For those of you who are joining me, welcome, welcome. Please feel free to put your questions into the chat. So I have questions on antibiotics. So we just kind of got done talking about like urinary tract infections, and urinary tract infections are treated with antibiotics. Just so you guys know, to kind of wrap that up, you cannot treat an active urinary tract infection homeopathically. You will read about that online. You will see a whole bunch of people that say they can do it. I'm sorry, I just completely disagree, and I'm very homeopathic, and I talk about supplements all the time. I mean, I just told you about food, right? So you're welcome, Thakshila. I hope I say this right. Thakshila is what I'm hoping it is, but you're welcome. So when you're talking about urinary tract infections, you cannot get rid of it with cranberry. That does not work. And the other thing you guys should know is when you're pregnant, you're immunocompromised, which means it's even harder for you to clear infections out of your system. So when you have an active infection, the only way to kill the bacteria is with an antibiotic. Cranberry juice is great for prevention. So let me be clear. I am very pro cranberry for prevention, because what happens is, and D-mannose also helps. So cranberry makes the iron acidic, acidifies the iron. Sorry, I said iron. Urine. It makes the urine acidic. Because it's acidic, the bacteria can't grow in there, okay? And so the bacteria has a really hard time growing, which is why you don't develop the urinary tract infection. D-mannose helps to prevent the bacteria from sticking to the walls of the bladder. So between those two things, if you're drinking plenty of fluid, you'll oftentimes just get rid of what little bacteria is there, thus preventing a urinary tract infection. My only caveat to potentially drinking cranberry juice, now remember guys, this is real cranberry juice. It's in a glass bottle. It doesn't have any coloring. It doesn't have any sugar, and it tastes so tart and awful to drink because it's real. Though that's the cranberry juice that helps you, not ocean spray. So the thing is, if you have diabetes, you need to avoid cranberry juice, because if you have cranberry juice, it has sugar, and that goes against your diet for diabetes. So when we need to give you antibiotics, there's several things that we'll potentially give you. So one of the questions I got was, is metronidazole safe for the baby? I'm 23 weeks pregnant. The other one was, is azithromycin safe during pregnancy? I also want to ask if any if any antibiotics cause birth defects. And I actually had a different question about antibiotics on my STD video, which said the doctor gave me azithromycin for a suspected STD. And then she said all of her tests were negative, but she ended up having a miscarriage. And she's heard that some of the antibiotics cause miscarriages. So here's what I'm going to say. First of all, the two medications mentioned, metronidazole and azithromycin, are very commonly used during pregnancy, and they are considered safe. And azithromycin is very commonly used to treat some of the sexually transmitted diseases we see. Now, if you go online, you're going to find out that everything kills you, everything. And I don't believe that everything kills you, but that's what you will see. Out there online, there's a whole bunch of misinformation. So one of the things I want to tell you is, for example, I am part of YouTube Health. That is a part of YouTube that YouTube's decided to create to make sure that YouTube viewers know they're getting legitimate information. So to be a part of YouTube Health, which is the same place you'll see like the CDC and the World Health Organization, to be a part of that, I had to apply. I had to show them my education, my actual doctorate. They had to look up the university. I had to show them my content. I had to prove that I had the credentials that I say I have. This is so that you guys understand that the information you're getting is legitimate. If you just Google, you're going to find a whole bunch of misinformation out there. And I promise there is actually probably bad things about everything, and we cannot be paranoid. If I recently had a patient who started a vitamin and she thought it was totally fine, and she started feeling very sick, and it was not good. And she was really getting very ill. And it was just a regular prenatal vitamin. Like nothing was really crazy about it. but she was getting rashes and all sorts of stuff. This was an organic prenatal vitamin that she had found. What she didn't realize was it had an offshoot of soy in it, and she's allergic to soy. So this vitamin was making her sick, but it wasn't the vitamin, it was an allergy that she had. So one of the things is that it's not always as bad as what you see. You need to look at health studies. And the health studies, you have to be able to learn how to read it, how to actually pick it apart and see if it's a good study, which is something I had to do in order to get my doctorate. So this is something that your higher level trained physicians and stuff have learned how to do. So if you have a question, please ask your doctor to help explain it to you. They should tell you about risks versus benefits. An example of a study that was scary to a lot of people. Several years back now, there was a study that came out that linked the use of lanolin cream with mastitis. And so the study came out and everybody's like, oh my God, we can't use lanolin cream anymore. Lanolin cream is the nipple cream to help your nipples when you're breastfeeding. So everybody stopped. Everybody's so scared to recommend it. And then a couple smart people looked at the study again. So the study failed to take into account one major thing. It failed to address whether the moms were washing their hands. So without that information, there was no way to show. But when they started looking at the data again, going back, they realized that many of the women probably had not been always consistently washing their hands. And therefore, it wasn't the lanolin that was making the mastitis, it was their dirty hands. So you see, that's an example of a study that comes out saying something really bad is happening. And when you look at it again, it's not what you actually thought it was. So you really need to make sure that you're looking at that kind of thing. But azithromycin is very commonly used, and there's a lot of safe anecdotal data about it, as well as metronidazole. Hi, Jess. What are the vitamin needs for postnatal versus prenatal? I am postpartum and no longer breastfeeding, but I'm still taking prenatal vitamins. Should I look into switching? My answer is no. I think the postnatal vitamins try to focus on fixing anemia and some of those things. I think they also want to say that they are ultimately helping to boost your milk supply. Postnatal vitamins are a lot newer of a thing, but ultimately I recommend all of my 14-year-old patients all the way up to like 52 to take a prenatal vitamin. So if you think about it, prenatal vitamins are actually the vitamins that are designed for us to take when we're within childbearing age. That does include 14-year-olds. I'm not promoting teenage pregnancy, but 14-year-olds technically are ready to go, basically. So once you're in that range, you want to take a prenatal vitamin. It's good for your hair. It's good for your skin, but I definitely don't recommend switching. And I actually have a video that's on prenatal vitamins. But the other thing is that I think what is more important is to make sure you have a quality prenatal. And sometimes people use gummies, and gummies don't actually have all the stuff you need. Because certain minerals are just not going to be good in a gummy. And like another thing that's not always in there is enough calcium. So we definitely need calcium, but no matter what prenatal you find, you're usually going to have to supplement with calcium outside of that. I also want to say that, again, the postnatal vitamins tend to be, I think it's like a newer concept. And it seems to me that when you're comparing them, the postnatal vitamins are oftentimes a lot more expensive because prenatal vitamins have been around forever. So a million people make them. And just so you guys know, cheap vitamins are oftentimes the best quality. But postnatal vitamins, not everybody does them. And therefore, they tend to be more expensive. So I hope that answered your question. Feel free to elaborate if you want to. Hi, Amy. My doctor is yet to confirm my baby gender at 15 weeks. Should I be worried? No, they might not. Okay. There's two ways to confirm gender. One is with a blood test. So if you didn't consent to the blood test, they wouldn't test you for it. So that's part of genetic screening. And I actually have a video on that. But like the triple screen and the quad screen, they draw blood. What they actually do is they can actually isolate your baby's DNA in the bloodstream, and then they can go ahead and they can figure out if your baby is a boy or a girl. So that is one of the ways that they can determine it. Now, the other way is with ultrasound, but sometimes you'll know early on, like at the 8, 10, 12-week ultrasound, it just depends. But a lot of times you don't find that out until 16 to 20 weeks of pregnancy, what the actual gender is. Ultrasound is less reliable, although it's getting a lot more reliable. With your gender also, when you're talking about the blood test, in the age of gender reveals, some doctors now are not just like going to proactively tell you. They don't want a medical assistant. So like if you got the blood work done and you're in between appointments and the blood work was normal, they're probably not going to call you. I order blood all the time. If something's normal, I'm not calling my patient. I need to focus on calling the abnormal. So I just tell my patients, if there's nothing there, the next time we meet, I'll talk. I'll go through the lab results, but I won't call you in the interim. So if your lab results are normal, the last thing your doctor wants to do is have a medical assistant accidentally, not on purpose, but accidentally reveal the gender of your baby if you don't want to know. Because a lot of people want them to like put that in a package and give it to their best friend for a gender reveal. So I would just ask the next time you go to the doctor, unless you haven't had the quad screen. If you haven't had that type of screening, then the only way to find out would be the ultrasound. So I hope that answered your question. Now, one of the questions that I had on antibiotics was about like what antibiotics should be used for a Bartholian cyst. So a Bartholian cyst is it's not very common. It's a cyst in the vagina that can happen, and we usually give antibiotics. I think in general, what you will actually see, you're welcome, Amy. In general, for any condition that needs an antibiotic, it depends. I wish I could give you like, this one's for this and this one's for this. There are some that tend to be used for certain STDs like syphilis and chlamydia. There are some that are traditionally used for urinary tract infections, but there's a lot that's in between. And so it's really on a case-by-case basis and what your unique profile is and have you been taking antibiotics already and stuff like that. Let's see. We had 2 questions kind of about formula. The first one was, does formula feeding help with brain development? And the answer is yes. I was not sure. I'm going to be just very honest. People like completely trash formula and I can't stand it. I'm very pro formula and I'm a lactation consultant. I have been a full lactation consultant for 13 or 14 years now. Very pro breastfeeding. I'm also very pro formula. When I see a question like this, I always get concerned that somebody's either really doesn't know and has heard so many bad things, or this is somebody looking for a reaction. So let me be clear. Formula does help with brain development, because if it didn't, we wouldn't be able to give babies formula. I was a formula-fed baby. I have a doctorate. I seem to have done just fine. Formula provides your baby with the nutrients your baby needs to live, thrive, grow, develop. Okay? Formula is sometimes the option that is the only option for a woman. We do not look at a woman who's had breast cancer and a double mastectomy and criticize her for giving formula. So if you're just a regular mom who needs to give formula because that's what you want to do, please do that. And don't let anybody try to make it seem like formula is this horrible, awful, neglectful thing that you're doing. Not everybody breastfeeds. And if for this person, yes, your baby will grow and there will be brain development. Are there advantages to breastfeeding? Sure, there are advantages to breastfeeding. I'm not going to lie about that either. But formula is not so bad that babies aren't just fine if you give them formula. So, yes, formula helps with brain development. Moving right along from that, I had a question. I have a video on what water to use for formula, because believe it or not, that's like a very confusing question. So it said, I've been using Evian water for my newborn without boiling it. Is it safe? So It is safe. Evian water, I own no stock in this company, is not necessary to be used. You do not have to use Evian. It's very expensive, but it is one of the higher end waters. And a lot of the organic groups and stuff like that will tell you that it's one of the best. I own no stock in Evian. I'm fine with the cheap stuff. But it doesn't need to be boiled. It's a very high quality and it's processed very well. So you don't need to boil that. If any of you guys have any questions, please feel free to put them in the chat like some people have been doing. I had a question on NSTs. So NST is a non-stress test. And the question was, why would a patient be having contractions if they are not in labor? So there's a couple reasons why you would have contractions if you are not in labor. Number one is just regular old Braxton Hicks contractions. Braxton Hicks contractions are like practice contractions. So the way the contractions work, their whole mechanism of action is you have a uterus and at the bottom you have your cervix, and your cervix is long, thick, closed. And the cervix actually kind of feels like this. At the end, it actually kind of feels like your two fingers. It's this kind of consistency, and it's pretty long like this. Now, it's closed, but it has to be able to dilate, right? So this represents the area where your mucus plug is. And when you dilate, the mucus plug comes out. But the mucus plug helps to prevent bacteria from going up, okay? Now, cervix, when you have contractions, the point of the contractions is to start doing this, to start getting that cervix to thin. That's effacement, thick to thin, and dilate like that so a baby can come down. That's the purpose of contractions. Now, when you're having Braxton Hicks contractions, what it starts to do is just kind of ripen this and soften this. And that is why when you're 38 weeks pregnant and they do a pelvic exam, you might be 1 to 2 centimeters dilated. Your cervix might be soft. It might be 60% effaced. That's what the Braxton Hicks contractions were doing. Number two, you are actually in labor. So why are you in labor? And you're in this weird kind of funky labor. So you can be in labor for a variety of reasons. Number one, infections. This is why we need to treat them. Bacterial, viral, fungal, yeast infections. They can all cause preterm labor, miscarriage, and stillbirth. We need to treat these infections. What happens is the reason why they cause like contractions is because the infection spreads to the uterus, causing uterine irritability, and the uterus starts contracting. One of the things you got to know is that your body is very primed to protect you first. It definitely does a lot to keep the baby going, but if your body senses something is wrong and you're in danger, it will try to induce a miscarriage to protect you. The reason why this happens is pregnancy puts a lot of strain on our bodies. And if the uterus is infected, the body may view the pregnancy as the issue. This is not anything you can control, but what you can control is getting proper treatment right away for any infections. So please hear that. Now, number three, you're in false labor because you are dehydrated. Oh my gosh, I cannot tell you how many women come in, they're contracting every 2 minutes, boom, 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 and they're dehydrated. We give them one bag of IV fluids and it's done. It is hot out there for any of you guys who are in the northern hemisphere. And so it is summertime and people are dehydrated and low in electrolytes and doing all sorts of crazy stuff. Please drink, please drink, please drink. If all you can drink is coffee, just so y'all know, yes, there is a caffeine limit and we have a video on that, but coffee is made with water. And if that's all you can tolerate, please drink something. If it's Gatorade, please do sugar-free Gatorade. If it's tea, if it's soda, I mean, whatever you can get into your body, try to make it low sugar. But you need to drink. Drinking is so important. And for those of you guys who want a very nice natural electrolyte, coconut water. If you guys look into it, coconut water is a very healthy water for pregnancy, and it's full of natural electrolytes. So this is something you can actually drink that might be really beneficial for you and for the pregnancy. But that's another reason why you will have potentially contractions during your pregnancy, because it's kind of a false labor. Now, the other thing is you can have contractions after sex. Okay. So the hormone that causes contractions is oxytocin. That is the natural form of Pitocin. A lot of us know the word Pitocin because this is the medication we use to start contractions during labor or to induce people as well. So oxytocin does a number of things. It's the love hormone, it's the bonding hormone. It's also the milk ejection hormone. So this is the one that says to your breast milk, eject, a baby needs to eat. But oxytocin is also the hormone that which helps us to have an orgasm. And after the orgasm, it like contracts the uterus. So what's happening is you may feel some of that after you've had sex and you've had a good orgasm. That can last for a little while. A lot of women will get really freaked out because they will have some hopefully very good sex and then they spend 30 minutes contracting. That can be normal. You do want to let your healthcare provider know what's going on because depending on other risk factors, you may not or should not be having that contractions for that long. So that's actually something you want to address, but that could be causing it. And I will tell you something. I actually have a video on pelvic rest. One of the things I talk about is you need to clarify what pelvic rest means. So pelvic rest usually is like nothing in the vagina, right? So no sex, no tampons, no douching, that kind of thing. But what happens with that is that you also want to ask if you are allowed to have an orgasm because you can actually have an orgasm without putting anything in your vagina. But orgasm causes contractions. So a lot of healthcare providers, when they originally started to say nothing in the vagina, they didn't take into account that we're a progressive society that includes masturbation and sex toys. So you need to be proactive with your healthcare provider about that. Okay. And then actually speaking off of that, I did have a question on my sex. I have several sex videos. I have one for each trimester and I also have one in general. And the question was, does the style of being on top of a woman have any side effects for a pregnant mother? And honestly, it just depends. The biggest thing with sex during pregnancy is it's usually just fine. You can have sex. One of the reasons why I did the sex series where it's like the sex by trimester and I have like different positions and stuff is because a lot of times there are different positions that are more comfortable based off the size of your belly and different things that are going on. So it really just depends, but there's not necessarily any side effects for that. Okay. So let me go to, I have 2 questions on yeast infections. I think I'm going to do those next. So let me start with this one. This is my 38th week of pregnancy and I have a yeast infection. My doctor provided me with a fentaconazole capsule. I am in a condition of panic. Is fentaconazole safe for use? Does it affect my baby? So, couple of things with this question. The first thing is, I am not familiar with fentaconazole because I do not use that here in the United States. So that's the first thing. So I cannot comment specifically on this medication. Number 2, Conazole, most of the Conazole, Conazole, those are the category of yeast infection medications. Most of them are safe for use during pregnancy. So generally speaking, these are safe, but you don't want to just go into a drugstore and pick up a medication and self-treat. You need to make sure we swab the discharge to make sure we know that it's a yeast infection, and your doctor needs to tell you how to treat it. Because, for example, we may not want you to use a suppository. We may want you to use an oral medication. It just depends. So you definitely want to go ahead and you want to make sure that you've talked with your healthcare provider. Now, a lot of the questions I get are related to meds, right? So a big thing is this safe? Is this safe? Is this safe? And guys, I am so grateful you're asking the questions and I want you to keep asking those questions and ask them to your providers. But sometimes the reason why we ask is because we want a second opinion, which I think is amazing. You should always get a second opinion if you feel unsure. Another place to get a second opinion is actually your local pharmacist. So pharmacists have specialized training in medication. They are up in the latest. They have the best software systems to like cross-reference and stuff. So your pharmacist is your secondary resource. If you've spoken with your OB provider and you're not sure, you can go to the pharmacist and ask questions and they can help you as well. Good morning from a Thai midwife. I am very flattered that you are here. Thank you. Welcome, welcome. Now, I have another question. It came in on my yeast infection video. I think this is an extremely important question, and I'm hoping everybody really listens to this because I took it to heart. I'm breastfeeding my 6-month-old baby. I have an itchy breast. Not always. Some days it goes away by itself. Then it comes back. I can't control the itchiness. There will be a rash there at times. After some time, the itchiness will go away. When I have itchiness, the skin will look like an orange peel here and there, like a bug bite. When I have itchiness on my breast, I feel like the other parts of my body are also itching. Itchiness will be on one breast, but sometimes both. What is it? So this is a very, very good question. So the short answer is I don't know what it is. Ultimately, enough of those symptoms sound like it could be an allergic reaction, but there are some warning signs in there. The biggest warning sign is when a breast looks like an orange peel. If you guys see this kind of look, you need to get it evaluated right away. And you don't take no for an answer. A lot of breastfeeding moms are turned away from getting proper breast examination because they're making milk, and that does not need to be that way. This would be a mom that I'd be sending to a breast cancer specialist. So one of the ways that breast cancer will show up is potentially with that orange peel look. Another thing that can happen is you can have itchiness. A lot of my moms who have treatment-resistant yeast infections of the breast, I actually tell them to go to breast cancer specialists. So here's the deal. I would say 95% of the moms that I tell them to go to a breast cancer specialist are completely fine. But breast cancer physicians look at mammography, like the mammogram images. They look at ultrasound images. They look at MRIs and CT scans of breasts all day long. That's the only thing they do. So who better to look at your breast and see if something is going on? And those are enough warning signs that there could be something potentially very serious that needs to be addressed. There are certain types of breast cancers that will actually grow faster when a woman is lactating because the hormones related to making milk actually can grow those hormones. The hormones love the cancers love the hormones that are being produced. So you need to make sure you are on this very quickly, because if you did have a tumor like that was thriving off of the hormones for making milk, that could actually get very big very fast and you wouldn't necessarily know it. Now, a lot of the other symptoms sounded more like a systemic allergic reaction. There is actually a condition where women are allergic to breastfeeding. It's extremely rare, but I think it is more common than people realize. But I don't think that's necessarily what's going on. It could also just be like maybe you're getting a bug bite or something. You feel very strongly you need to go, you need to insist, they need to send you to a breast cancer specialist and they need to do a mammogram. Okay. And for any of you guys who know any woman out there who might be having any weird symptoms of the breast, tell them to get an MRI. Oh, wait, I'm also really big on guys. Just so you know, dads, men can get breast cancer too. I'm going to sound like such a dork here, but one of my first papers when I was in middle school was on breast cancer in men. I wish I still had it to this day, but I did a paper on it because men and men's health is just as important, and men can get breast cancer. And usually when they get breast cancer, it's diagnosed so late, their survival rates are a lot lower than women because we don't talk about that. So Anybody you know who's having any weird breast symptoms, make sure they go and get it checked out. I have 2 more questions on my side. So if you guys have any questions, please feel free to put them into the chat. This question is pretty kind of quick. When does twin A turn head down? I'm 28 weeks and A is still in the transverse position. Okay, so transverse is kind of sideways instead of down, right? So babies can turn all the way up until like the day before you deliver. There have been women, I've taken care of at least, 3 or 4 women who were scheduled for a C-section because their baby was breech and the baby turned the night before they showed up. They reported that the baby did this massive flip. We feel the baby, seems like the baby's head down. We do an ultrasound. We got a head down baby. The mom's never had a C-section before. We go ahead and we deliver her vaginally. That does happen. Babies will usually start to settle into the head down position late in the 3rd trimester, like 34 to 38 weeks. That's kind of when they go into place. Twins tend to be a little bit sooner, but at 28 weeks, you still got a lot of time to kind of go with that. Now, the other thing is, this is one of the unique things with twins. We label it twin A and twin B. It's very important because twin A and twin B, we then follow. And of course, we compare all of their scans and all of their everything, right? But twin A and twin B, the actual A and B, it's arbitrarily assigned. When you're first pregnant, like these babies are too small for us to figure out which one's going to come out first. So you can actually deliver twin B before twin A. So it may not matter if twin A is transverse at the time you deliver, if twin B is head down, engaged, and ready to go. So with twins, there's less space, right? So sometimes one of the twins kind of manages to get down first, head down, and this forces the other baby into like this transverse, right? But if the head is here and the baby goes down, the other twin will then fall into place, and then you'll end up delivering 2 babies. If you have a baby that's transverse or they're both transverse, like both transverse, we're probably going to do a C-section. If you have one baby who's lower down that's transverse and the other baby's up here head down, that's also going to be kind of hard. But I wouldn't worry about it quite yet because they're still kind of settling into position. And this twin position is actually one of the reasons why, and many people don't know this, but I put this in my twin video, you will actually deliver twins in an operating room. So it's in an operating room that you will actually be delivering because we may end up having to do a C-section. There are some women who will deliver the first twin vaginally and the second twin by C-section. And so with twins, we always want to make sure we're ready to go because we have 2 babies. So one baby could be completely standard normal delivery and the other one could end up being an emergency. So we're kind of all ready to go depending on what happens. Last question. It was on my swelling video. It said, I'm 14 weeks and my face is swollen. I hate it and I worry it'll get worse as I'm only 14 weeks. I'm struggling with my diet because I used to eat very minimal processed food. And now because I got so sick, it was all I craved. How do I eat healthily when I don't feel like it, but need to eat? I'm eating things that I really shouldn't, especially wheat and dairy, which cause some of the problems in my body. Would really appreciate some advice. So unfortunately, the advice tends to be try to not eat those foods, right? But here's what I'm going to tell you. This person mentioned wheat and dairy. Wheat and dairy, I'm assuming, is a problem in their diet. If you're going to eat bad food, right, but you're allergic to wheat and dairy, start by trying to get rid of the actual ingredient that makes you sick. And don't focus so much on the bad food. This is what I mean. If you're allergic to dairy and you've been eating ice cream, stop eating cow's milk ice cream and eat soy ice cream. So start by getting the actual toxin. If you're allergic to wheat, that's a toxin for your body. Get rid of the toxin. Don't focus on the health. Because by getting the toxin out of your body's going to feel better. When you feel better, you actually have a little bit more willpower. If you feel sick, it's really hard to stick with anything. So start by just getting rid of the bad stuff. Then now we're on to junk food that's not toxic for us, right? Now start saying to yourself, I'm going to commit to 1 meal a day of whole foods, and the rest of the day, whatever I want. If I want junk food, I'm going to eat my junk food. Because making little changes and then sticking to them creates a success. And again, if I get you to eat 1 meal a day versus 3 meals a day that's healthy, that is better than 3 meals a day of junk. Give yourself credit and keep moving in that positive direction. And that can slowly start to help. Now, finally, so the swelling in the face, couple of things. Number one, even if you're going to stick with junk food, try to see if you can avoid salt. Salt can cause that. Number two, you may want to ask your doctor to check your cortisol level. When cortisol levels are high, it can actually cause swelling in the face and swelling in the belly, and it can lead to something called Cushing's disease. So if you've been exposed to a lot of steroids, that actually could be the cause, and then you want to get that checked out because it may need to be treated. Oh, and the third thing is watch your blood pressure, because blood pressure is a common cause of swelling. So that is it for me. I am Dr. Samantha, the maternity mentor. Thank you so much for being patient, as I wasn't here last week because I was out enjoying time with my family. We have no video for tomorrow, but please check out some of my latest videos. I think you're going to find there's a ton there for you to look at. Please share the channel with your friends and family. Follow us on Facebook and Instagram. Please like and subscribe. Subscribing to the channel is actually the most important thing for me. As content creators, it's important that we constantly get new subscribers, maintain our subscribers, because YouTube is looking for that in order to kind of keep supporting a channel like mine. So please feel free, or please, if you can, subscribe to the channel. I really appreciate all of you. I will be back next Monday at 9 p.m. Eastern Standard Time here live to answer your questions. And I really appreciate all of your support. And I'm so happy you all joined. If you missed anything with the broadcast, it will be posted onto the website so that you can look at all of it later. My name is Dr. Samantha. I am the maternity mentor. I really appreciate all of you. Thank you so much for joining me. Bye for now.